tumor heterogeneity is becoming an increasingly recognized phenomenon, and it's very difficult to incorporate that into decision making. We used to think that tumor cells were all identical to each other. They were all carbon copies of each other. But now we know that as tumors grow, that you may get clonal diversity, just like over evolution, we have diversity of organisms on this planet. Well, a tumor growing is like evolution, but in a fast time frame. And as the tumors grow, different cells within the tumor may start to acquire different genetic changes, and then a certain part of the tumor may grow with a different protein as a different part of the tumor. And then if you have selective pressure, you're giving the patient a drug that might select out one of these subclones, you end up getting differences in markers across the tumor. And so we're now seeing that when we do things like estrogen, progesterone receptor, or HER2 analysis, that we may find that the whole tumor doesn't behave uniformly. Some parts of the tumor may be HER2 negative, some parts may be HER2 positive. Now in the case of HER2, this is probably not a very common thing, but it has been documented in some studies, although not so much in others. So it's still a controversial notion, but we do know that tumor heterogeneity exists. And now the problem is, how do we deal with it? How do we use that information? Certainly, it is not something we're routinely using. If you look at all the guidelines for how a pathologist should grade ER, PR, or HER2, it's by counting a lot of cells and then averaging them. There really isn't accounting for these sort of patches. It's being a little more recognized in the HER2 area, and some pathologists now are starting to report these. But what do you do if you have just a small patch of HER2 positive cells and the rest of the tumor is HER2 negative? Should those patients get trastuzumab? These are questions that we simply don't know. So tumor heterogeneity is an evolving area. We think it's a very interesting window of opportunity to learn about mechanisms of resistance in the research setting, but on the clinical side, in terms of decision making, it is really bedeviling us. We just don't know how to handle it yet.